If you have followed this channel, you heard me mention PRASAD in almost every video. Today, I answer the question I'm asked most often. Doctor, am I a candidate? And I will answer it the way I answer it in my clinic, with criteria, not with enthusiasm. Because a treatment that claims to be for everyone is a treatment that has not been honest about its limits. There are four gates a knee must pass before I will offer PRASAD: structural, metabolic, mechanical, and commitment. Let me take them one at a time. The structural gate. Is there enough joint to work with? The first gate is structural. The question is simple. Is there enough joint left to preserve? I look at your X-ray at the Kellgren-Lawrence grade. PRASAD is for grade 2, grade 3 and early grade 4. There must be cartilage and joint architecture still present. If the joint has collapsed completely, the architecture gone, PRASAD is not the answer. And I will tell you so plainly. PRASAD preserves what you still have. It does not rebuild what is already gone.
It is vital to protect the cartilage. This smooth surface is what remains. We must protect what exists. Prevention is always better than a cure.
So, the first question is always how much is still there to protect? The metabolic gate. Your numbers decide as much as your X ray. The second gate is metabolic, and it is the one most clinics ignore. Your knee does not heal in isolation, it heals in the environment your body gives it. I check four blood markers and I read them on a simple traffic light: green, amber, red. Green or correctable to green, and the biology is ready to work with us. Red, and we fix the ground first. Because treating a knee in a hostile environment wastes your time and mine. I'm not going to teach the whole science of those markers here. I have a separate video on blood sugar and the knee with more to come on the metabolic terrain. For today, the point is simply this. Your numbers decide as much as your X-ray. Bring them. The mechanical gate, the alignment of the leg. The third gate is mechanical, your alignment. If the knee is badly bowed or knock-kneed, the load runs through one side of the joint. Treat the biology without correcting that, and the same overload that wore it down will wear down the result. So, I assess your axis. If it is neutral or correctable, we proceed. If it needs correction first, a brace, or in some patients, an osteotomy to realign the bone, that comes before PRASAD, not after. The right environment includes the right mechanics. The commitment gate. Preparation is not optional. The fourth gate is commitment, and it is not optional. Before PRASAD, I ask patients to prepare the ground, to correct the metabolic markers, to follow the preparation protocol I give them. This is not a single injection you receive while you carry on exactly as before. It is a biological treatment that works best when the body is made ready for it. If a patient is unwilling to do that preparation, then however good the structure and the alignment, the timing is not right. I would rather tell you that honestly than take you on and watch the biology fail. So who is PRASAD really for? The patient with grade 2 to early grade 4 arthritis, architecture still present, whose metabolic markers are green or can be made green, whose alignment is neutral or correctable, and who is willing to prepare properly. When all four gates are passed, the biology is ready to be worked with. That is the patient who does well. And notice what I have not said. I have not said PRASAD regrows cartilage. What it does is preserve what you still have by treating where the destruction is being driven from. That is the honest offering. And it is for the patient the four gates point to. In a later video this month, I will tell you who Prasad is not for. That video is equally important because an honest treatment has honest limits. And knowing where those limits are is part of what makes the offering credible. If you have your 4 blood markers and your X ray grade, bring them to the inquiry. Those numbers tell me more about your candidacy than any scan or symptom alone. I am Dr. A.K. Venkatachalam. I will see you then